Do you have pain in your elbow when you're squatting? Let's fix that. In order to understand how the elbow works, think back to high school when you did group projects. And there's 3 of you guys, and 2 people aren't doing a whole lot, and the 3rd person has to do a ton of work. That's the elbow. The elbow is compensating for your wrist and your shoulder. In order to get in a proper squat position and release stress from the elbow, we need enough external rotation of the shoulder, so let's go ahead and screen for that. You can do this on a squat rack, and if you don't have a squat rack at home, you can also do it on a door frame. In order to assess shoulder external rotation, let's get into a 90-90 position. So 90 degrees flexed and 90 degrees on the elbow. Here you're going to walk up to the wall and have the wall or rack in line with your body, and you're going to rotate your shoulder off. Now that we know external rotation is limited, let's fix that. So there's about 5 muscles that work on external rotation. You got your subscapularis, you got your teres minor, you have your anterior delt, you have your lats, and your pec major. For all intents and purposes, especially if you've been lifting, it's probably gonna be your lats or your pec major is a little too tight. Let's get in and treat both of them and figure out which one is right for you. So to mobilize our pec, let's get in the same position we did to test external rotation. From here, you're gonna stagger your feet and lean forward. You should feel a stretch through your chest. And if you want to make it a little more intense, you can also rotate away. In alternative positions, you can get your elbow out of the way so the rack's not blocking it and get into more external rotation. What we don't want to see is the elbow behind the rack, because that's just anteriorly translating the head of the humerus, which can cause impingement. So for me, the pec stretch is very effective because that's what's limiting my external rotation, which is causing extra stress on my elbow. Now, if you fall in the same category as me, go ahead and do that pec stretch a couple more times. So if you did the pec stretch and found it didn't really help at all, let's go ahead and stretch your lats now. In order to stretch your lats, you're going to need a bar, or you can use a countertop. You're going to put the arm that's having pain, so for me, the left one as the underhand, and then your other hand on top. From here, you're going to shoot your hips back, so your arms are now up by your ears, and then you're going to rotate your hips away from the arm. I also do a little bit of a contralateral rotation, so if my left arm needs stretch, I rotate to the right. Here's a backside view of how I get my body into position. It just takes a little bit of wiggle and adjustment to find the right spot for you. Now that we cleared up the shoulder, we're not exactly done. You clicked on this video likely because you have elbow pain, so let's address the elbow a little bit. It's likely flared up, so let's try to get that calmed down and help the healing process. One thing I really like to do is just a soft tissue massage. Whether that's using a massage or a Theragun or just getting your hands in here and rubbing on your elbow, that can really help to increase the blood flow and decrease pain. Another thing we can do to address the joint is a joint mobilization. So if you have a TheraBand, you can wrap it around your elbow. You're going to want to put it just distal or below the elbow crease. From here, take a step out so you have some tension on there, and then I'm just going to open and close my fist. So we cleared up our external rotation by improving the mobility of our internal rotators. We did a little soft tissue or joint work on the elbow to help calm it down. Now you should be good to go to squat without any pain in that elbow, or at least greatly reduce pain. Keep doing this until you have consecutive sessions of squatting with no pain. I hope it helps, and I'll catch you on the next one.